Did you know, according to Injury Facts 2017, 5,051 people died due to choking? I bring this up because many of these deaths possibly could have been prevented through the use of CPR. So today I'm going to show you how to perform CPR on an unconscious victim. So the first thing you want to do before you even start performing CPR is to make sure that the scene around you is safe. The second thing you're going to want to do is either have a bystander or you yourself call 911. And the third thing you want to do is open the airway. You do this by grabbing onto the sides of the head and tilting the head back so that the chin is up and out, and this opens up the trachea. So again, you're going to grab the sides of the head, tilt up so that the chin is poking out and that your trachea is now open. The fourth thing you're going to want to do is check for breathing. You're going to do this by bringing your head down to the head of the victim. You're going to bring your ear to their mouth and you're going to face towards the chest of the victim, and you're going to be watching for a rise in the chest, or you're going to be listening for their breathing. If you do not see a rise in the chest or you do not hear any breathing, that's when you proceed to CPR. So the first thing you're going to do when performing CPR is chest compressions. How you do the chest compressions is you do one hand over the other and you keep your arms straight. You do not bend your arms while you administer the compressions, because it will not, you need to do at least a 2-inch deep compression while you're doing them. And bending the elbows will not do that. So you need to keep your arms straight and you're going to be pushing with your entire body as you administer the compressions. You also need to keep a rhythm while you administer the compressions. So with your hands in the middle of the chest, you're going to keep your arms straight and you're going to count 1 and 2 and 3 and 4 and 5 until you reach 30. Once you reach 30 compressions, then you're going to move on to the rescue breaths. You administer the rescue breaths by plugging the nose of the victim and bringing your lips down to the victim's lips to create a seal, so you know when you are exhaling your breath that it is going into the lungs of the victim. Also, as you administer the breaths, you want to watch the chest to see if the chest is rising. When you administer the breaths, if the chest is not rising, the first thing you want to do is reposition the head. So you're going to tilt it back even more to try and open up that trachea. Administer 2 more breaths. If those 2 breaths do not go in, then you need to look into the victim's mouth to see if there is any obstruction in the way. If you see it, then you should take out the obstruction. If you don't see it, move back to the compressions, and then after the compressions, check to see for the object and so forth. After you get the object dislodged, if the person is still unconscious, then you still continue, and they're not breathing, then you still continue the cycle of 30 compressions to 2 rescue breaths. And you continue this cycle until either EMS arrives, the person shows signs of life, or you become too exhausted to continue. The primary reason you check to make sure that the scene around you is safe before you start CPR is because you are the primary person in this situation. And if it is not safe for you to proceed, then you should not proceed. You also want to make sure that either someone close by or you yourself call 911 before you start CPR, so that you know that there are medical professionals on their way to take over if need be. Also, when administering the compressions, you want to make sure that you are going at least 2 inches deep into the chest, so that it is pushing whatever object is lodged in their trachea out. And then as you administer the rescue breaths, you want to check to make sure that the chest is rising so that you know that the breaths are entering their lungs. Knowing these few easy steps, you could end up saving someone's life, and it could prepare you for a situation that you think could never happen. Thank you for listening.